welcome back. You're still watching It's a Beautiful Day. This is Weather HQ. Now, the latest DOST-FNRI data shows that 2 in 10 Filipino adults are now pre-diabetic. Now, to help us understand why diabetes remains a serious health issue and how we can prevent it, joining us via Zoom is Dr. Mia Fojas, Clinical Associate Professor from the Division of Endocrinology and Diabetes and Metabolism at the Philippine General Hospital. Good morning, Dr. Fojas. It's a beautiful day.
Good morning. It is a beautiful day. And thank you for inviting me for this talk.
Doc Mia, I wish that we had a more beautiful topic, but we're talking about diabetes here. And dito sa Pilipinas, it actually is one of the top 5 leading causes of death in the Philippines. Just why is it such a problem for Filipinos in general? And of course, can we actually boil that down to yung general lifestyle at culture natin dito sa Pilipinas when it comes to food choices and of course, all of the day-to-day choices we make?
Oh, yes, of course. It is definitely one of the lifestyle diseases that are currently one of the problems of in the Philippines. However, we always teach our students that diabetes is really not usually signed up as a cause of death, but it is one of the, it's in the statistics that it's supposed to be one of the leading causes of death because it complicates other diseases like yung atherosclerotic cardiovascular disease. If you add that on to hypertension, diabetes actually complicates everything, including infectious diseases. Patients are more, individuals are more prone to diseases if the blood glucose is poorly controlled. So it's actually increasing in the Philippines. It's almost 9% as of 2023, and it's rising because of a lot of factors, not just the culture. Previous patients who have been diagnosed, for example, with obesity and who have not been managed adequately, they can proceed to diabetes and a lot of other lifestyle factors that can be actually changed. These are actually modifiable.
Doc, let's talk about yung mga pre-diabetic because as a latest study, around 20% of young Filipino adults are now considered pre-diabetic. And let's first differentiate that. When you're pre-diabetic and haven't moved on to actually being diabetic, what's the difference in terms of yung mga health restrictions, health requirements, and of course how that changes in your body? And of course, can you actually shift from being pre-diabetic to not at risk?
Yes, that's true. You may be pre-diabetes may not proceed to diabetes, especially if intervened early. Like for example, as you can see in the FNRI data, did you show that? But anyway, in the FNRI data, there was a decrease or a decline in the prevalence of pre-diabetes or impaired fasting glucose or impaired glucose tolerance in the Philippines. However, diabetes is rising. This could be because of better management among patients with pre-diabetes. They are now more knowledgeable regarding the diet, like to avoid sugars. Remember, sugars are the new addiction right now. So perhaps what we can probably do is educate people some more. And I think the government is actually doing its part with regard to awareness. However, with regard to the availability of healthy foods, that's actually a problem. So healthier foods can actually be more expensive right now.
Yeah.
However, what we can see is that younger individuals now have a higher prevalence of diabetes because of perhaps stress-related or work-related, because a lot of the individuals that have been cited are the working age group. So a lot of our people are actually working and they don't have breaks, and there's the availability of fast foods.
Yeah.
Yeah, so not really healthy, and the lifestyle with a sleep cycle, that's another stressor that can actually increase the blood glucose levels as well. So again, this can be prevented from proceeding to diabetes for those who have been diagnosed with pre-diabetes, because it's mainly lifestyle modification. But
Yeah.
we do have available medications for those individuals who are obese in the first place, as a major one of the causes for pre-diabetes proceeding to diabetes.
Doc, you mentioned a lot of key points I want to dive into. Ako personally, nakita ko yung material namin na pinakita dito, and nag-relate ako hindi sa exercise pero sa kumakain eh. But when you look at you mentioned that there are now, especially for younger individuals, it's not necessarily yung eating habits per se, considering that there's actually a trend of more younger people having more health conscious decisions when it comes to their food, when it comes to exercise. But you mentioned the stressors here, and maybe that might be an underrated aspect of the move to pre-diabetic to diabetic. When you take a look at just how much of a factor we should also consider yung mga stressors, especially when it comes to work, the sleep cycle in particular, just how big of a factor is that going forward from pre-diabetic to diabetic?
You have to understand that stress can increase inflammation, or your ability actually to respond to different challenges with your health. So that is a problem. It's a one of the factors actually that can actually mahirap i-control. So it is one of the, I don't have the numbers how
Mhm.
much it can impact pre-diabetes proceeding to diabetes. However, it is one of the biochemical parameters that we see that if there's an increase in cortisol, there's also an increase in blood glucose levels.
Mhm. Well, you also mentioned that when the stressors come about, it actually goes and helps actually hasten yung diabetes or actually moving from pre-diabetic to diabetic. That also brings up the topic of mental health here. Does mental health actually, a sound mental health actually help prevent diabetes? And of course, when it comes to the factors affecting you stress-wise, does
Yes.
staying away from those particular aspects of life or addressing that actually help in preventing diabetes, apart from, of course, a proper diet and exercise?
Essentially, if you have very good mental health, if you're mentally healthy, you make good choices. And that just not, that includes, of course, your lifestyle, the way that you choose your food, the awareness of your bodily conditions and your abilities to respond to different types of challenges in life. So that matters a lot, the mental health.
Gusto ko yan, when you're mentally healthy, you make good choices. And now that questions some of my personal choices in terms of food. But Doc, let's assume that someone's already diabetic. Let's say around type 2 diabetes. And in terms of treatment, it's important to actually be consistent and, of course, really address the lifestyle changes. What are the typical stumbling blocks that you see in patients when it comes to keeping true to yung mga treatment nila?
Yeah. Number one kasi finances. Medications for the treatment of diabetes do not come cheap, especially the more effective ones, the high efficacious, the more potent ones are more expensive. For example, those individuals who have diabetes, but because they are obese.
Mhm.
So we've talked about the GLP-1 receptor agonists, the ones that can make you lose weight. And in so doing, when they lose weight, blood glucose improves. But these medications are injectable and they are expensive. So one of the stumbling blocks would be that, and the availability of these medications. And number three, of course, some patients cannot accept that they have diabetes because they do not have any symptoms allegedly. So there are subtle symptoms, but some of them would be in denial. Especially when it comes to eating with the family, of course, medyo mahirap to adapt Kasi kung minsan nakikita nila yung mga pagkain gusto nila, tapos hindi nila makain. So there is a problem with adherence to the diet as well. So with regard to the availability of the infrastructure for exercises and of course the availability of healthy foods, that's another problem. So it's really a societal thing. It's
Yeah.
not just the individual that has a problem, it is also the society. And again, our government as well does not really cover so much about so much for those people who have prediabetes or at risk for prediabetes per se. So what the government is addressing more would be the disease already. So for the preventive factors, medyo may kakulangan tayo. Mahirap din naman because of the infrastructure. I mean, the budget allocation is not enough.
Yeah. Well, Doc, you know what? We could go all day talking about this. One of the things that really stuck out for me there is that mahal talaga magkasakit. The
Yes.
medication obviously really expensive. It's cheaper to be healthier, and hopefully we can get more people healthy as well. Doc, thank you so much for spending your morning with us. We really appreciate it. You really are ready anytime. We appreciate you, and hopefully we can talk to you again some other time soon. She is a clinical associate professor from the Division of Endocrinology, Diabetes, and Metabolism at the Philippine General Hospital, Dr. Mia Fojas. Maraming salamat po. We hope to see you again soon.
Thank you.